Okay, welcome everybody. Very exciting to kick off our MBA lunch speaker series that we started last year, profiling faculty and their research and other interests that they're working on. And we are kicking off with a special guest star for this first one for the 2015-16 year. Ritu Agarwal is right now serving as a Senior Associate Dean for Faculty and Research in the Dean's Office with a broad range of responsibilities. But we're going to really be talking more about her research interests and her background, in particular in the area of healthcare. Ritu is the Robert H. Smith Dean's Chair of Information Systems. She served as the department chair of our DOIT department last year. And most importantly, maybe for this conversation, is she founded the center that we call CHIDS, which stands for the Center for Health Information and Decision Systems. And that will be a big focus of our discussion today, is the intersection of IT and healthcare. So the format, for those of you that haven't been to one of these before, first of all, we are doing a video of it, so just be aware of that. I will start off by asking a few questions. And really what I'd love, and Ritu would love as well, is if you all have questions and give you a chance to interact. But I'll kick it off, as I said, and I guess the first question, just to get a little bit of context here, is understanding how you got into the area of healthcare. Obviously, we all care about our health, and we all use healthcare services, so it's a critical area. But how, in particular, from your perspective of coming in as an IT expert, did you really embrace the area of healthcare?
Good afternoon, everyone. Thanks for taking a little bit of time out of your day to come and listen to me. So before I answer Alex's question, I just want to say that this is an area that I'm incredibly passionate about. It's an area that has sort of consumed my life and my thinking for almost a decade now. So I'm going to roll the clock back a decade to answer Alex's question more directly. How did I get interested in healthcare? Well, it occurred to me exactly 10 years ago that we were doing a lot of very interesting and useful research in business schools, right? We understand how to make businesses and economies function better and more effectively and efficiently. But we really hadn't started tackling what I would call sort of the wicked problems of our times. So, if you think about poverty, you think about climate change, you think about environment, and you think about healthcare, there's an incredible wealth of knowledge that all of us here generate as researchers and scholars and teachers. And wouldn't it be nice if we could take some of these insights and apply them to problems that really matter? And then it also struck me that in my own area, which is information systems and technology and decision models and data, that you could use many of the findings from our research and apply them to generate a lot of value in the healthcare sector. So that's really how the journey began, right? And I started the Center for Health Information and Decision Systems. And at that time, the vision was, let's take what we're already doing, let's take all the scholarship, all the research that we're doing, and apply it to the healthcare sector, which is not studied as much in business schools. I had a PhD student at that time who was also incredibly passionate about it. And we launched the center. And the center was constructed to really work at the intersection of three different things. One, technology. Clearly, technology was a big piece of the story because, as I'm going to tell you in a couple of minutes, there are just amazing, incredible, and sometimes astounding problems in healthcare. And you ask yourself, every other sector of the economy has been transformed through technology. Why is healthcare lagging so far behind? So one piece of where the center works is technology. But equally, the second piece is what we call strategy, that you really can't think about, transforming healthcare organizations or processes unless you look at strategy very closely. And the third piece is policy, right? Because we want to do research that's relevant. We want to do research that affects not just the academic community or the business community, but also provides some insights into folks on Capitol Hill, people in federal and state governments who actually make these decisions. So that's where my interest in healthcare started, and it's just been an incredible ride for the last decade. We have such a deep network of partners. I'm proud of the organizations that are working with the center. These include organizations on campus, academic units on campus, the School of Public Health, the School of Medicine, lots of federal and state agencies, and then lots of businesses, both large and small. So let me just pause there. I hope that gives you a sense for
that's a great overview.
Where this started. I sort of get carried away, but that's...
So in terms of the issues that we hear about healthcare, that a large section is focused on the cost, the escalating costs, and then the other dimension, or one other dimension, is the quality and how we can improve. So perhaps you could give us a couple examples of what you view as kind of the low-hanging fruit in terms of the impact, in particular, that technology can have on solving either or both of those problems.
Okay. Well, I always like to start with some statistics because I think numbers tell a story that is quite compelling, right? So today, 18% of the GDP is healthcare, right? Which means 1 in every $6 that we spent is spent on healthcare. In 2012, the Institute of Medicine released a report saying that close to $750 billion that we were spending in healthcare was wasteful spending. Okay, 30% of the total healthcare bill is wasteful spending. Now, what's this wasteful spending? Unnecessary tests, right? So every time you go to see a doctor, you have an additional test because the doctor doesn't have access to your previous results. Administrative waste and fraud. How many times do you get a letter from your insurance company giving you some meaningless piece of information about this is not a bill or this is how much you owe, and then you get the same bill 3 months later? So to your point about how can technology help save costs, just think about a scenario where patient data is widely shared and accessible, assuming somebody has the rights to access it. You don't have a lot of unnecessary testing. You don't have a lot of administrative waste. Your systems can help you identify if somebody is filing a fraudulent insurance claim. Okay, all these are examples where cost and quality can easily be affected. Okay, so these are sort of the low-hanging fruit, right? We've done it in retail, we've done it in finance, we've done it in every sector of the economy, but we haven't done it in healthcare. There are also some more difficult fruit to capture. Okay. And I think that's sort of where the future of healthcare is heading, because if you think about, big developments like data analytics, genomics, right? What can we do with that would allow us to improve the quality of healthcare? Well, one thing we can do is to say that, look, this one-size-fits-all approach to medicine that we've had all along, that what works for Lele also works for Alex in terms of a therapy. We need to walk away from that. And just as we can customize our cars, if we like, we can also have interventions in our health that are customized to us. Okay, that's what President Obama calls precision medicine, and that's really the big next play of technology in healthcare.
So you talked about before about policy, and obviously the Affordable Care Act is the thing that everybody thinks about. Within the 1,000 pages or whatever that none of us have read, do you think that there were positive steps in terms of the impact of technology and how we should be investing in order to save costs and improve healthcare?
Yeah. So I haven't read the entire Affordable Care Act, but I can tell you that the word information technology or health information technology appears 42 times in it. Okay, so this vision of a technology-enabled transformation is sort of front and center in the last 2 major legislations that have been passed around healthcare, right? Just roll back a little bit. In 2009, the U.S. Congress passed the Hitech Act, which stands for Health Information Technology for Economic and Clinical Health, and that was the act that really precipitated the growth in electronic medical records and the early stages of digitization in healthcare. And then the ACA came along, which tried to build upon these high-tech initiatives. And the idea here was, well, can we reduce cost and improve quality by aligning the misaligned incentives in healthcare, right? So the push here was to say that, look, patients are incentivized to get more tests because they don't experience the cost of healthcare because the insurance company does. Doctors are incentivized to do more testing and recommend more treatments because, as before, they are paid on a fee-for-service model as opposed to a fee-for-outcomes model. So a big piece of the ACA was to say, okay, let's align the incentives, let's reward doctors on somebody's health actually getting better. And how do we find out if their health is getting better? We track it, okay? We track it continuously through technology. We have systems that allow us to see how somebody's hemoglobin A1C is doing, that allow us to see whether their blood pressure is under control. And then we also engage patients more in their healthcare by giving them information, right? So today, if you need to buy a plane ticket or a refrigerator, you're going to go online and look for reviews, learn a lot about the product that you're purchasing. We've never had this kind of transparency in healthcare, but today we do, and driven in large part by systems and technology, because the government has released a lot of healthcare data, about comparative data about costs, right? So you can see what it costs to get a hip replacement done in Bethesda, Maryland, versus Skokie, Illinois, and you can decide whether it's worth your while to fly to Skokie, Illinois to get that the hip replacement done. So these are just some examples of how technology is driving down cost and also improving quality under the ACA provisions.
So I'm going to ask one more question, then open it up as you think of your questions. But you mentioned data analytics before, and obviously probably in this room that we have a variety of students who are thinking about careers in healthcare and where the opportunities may be. So what would your kind of recommendations be in terms of where the greatest opportunities lie for students to pursue careers in healthcare, either within the data analytics sort of realm or even more generally?
Yeah. I think the most recent statistics from the Bureau of Labor Statistics suggest that sort of the two fastest growing occupations in the United States are in the healthcare space and then, not surprisingly, sort of in technology and analytics, right? So this is a robust time for students who are interested in healthcare. There's a wide range of opportunities. There are the sort of the traditional healthcare jobs related to management and administration. So many healthcare organizations are looking for good managers at senior levels, including hospitals, insurance companies, which people who have a lot of the skills and capabilities that you would expect from mid and senior level managers, but who also understand sort of the nuances of the healthcare industry and specific dynamics within how different organizations in healthcare work with each other. So healthcare financing, healthcare administration, all these are big growth areas. Definitely, technology, analytics, and systems in healthcare, health information technology, is a huge growth area. So if anybody has the skills and are interested in tech, it's a growth area both in traditional organizations, but also entrepreneurial opportunities. So, my center works with an organization called the Maryland Health Tech Coalition, which is a bunch of startups that are developing health IT apps and different kinds of interventions for hospitals, insurance companies, and they're always looking for talent. Plus, if you have good ideas, this is a great time to come out with a new health IT application or product that you can monetize very easily. So huge, huge growth.
That's great. Well, let's open it up if any of you have any questions for Dr. Agarwal. Yes?
So thanks so much for your time. My question relates to the fact that IT technology in healthcare is really an enabling tool.
Mm-hmm.
But so much of that depends on your ability to actually extract value and find useful needs of that tool. So I'm curious on a research level, from your research and investigating the effects that IT systems and technology have on on outcomes and quality, as well as on a practical business level about how to actually drive value, how do you measure, and how do you capture, and how do you encourage the actual correct use? Because one thing to have data available about a patient, but there's this notion that doctors aren't necessarily trained at the moment to be analytical folks, and from a longitudinal perspective. What are your thoughts?
Yeah, that's a great question, and thank you for setting this up for me, because most of my research in my early career was around exactly the questions that you raised. It was around the adoption and diffusion and the assimilation of information technology in organizations, because at the end of the day, it is just a tool, right? And the value is going to come from if people are motivated to use it and they use it correctly. So I've taken a lot of those same ideas and brought them into my research in healthcare. So for example, I spent a couple of years at the Children's National Medical Center studying in extensive detail the implementation of a clinical decision support system for doctors, and discovered a lot of insights and actually developed some specific recommendations for how to drive these changes forward. But these were not recommendations around how to design the technology better, but it was really around organizational change, about how do you message the doctors, how do you get them to adapt their clinical practices to this new tool, and then how do you continuously reinforce that behavior through a system of appropriate organizational incentives. So your point is very well taken, and that's a challenge that this entire healthcare ecosystem is facing right now, right? Because the practice of medicine has a history that goes back centuries, and doctors are amongst the most, they're terrific experts, but they also have particular ways in which they like to practice, and they are recalcitrant to change. So we're trying to address that.
Any other questions? Well, while you reflect on some, let me go ahead and ask another question. So you're talking about some of your earlier research. Maybe you could share with us the research that you're working on right now.
Yeah, sure. So let me highlight one particular project that I think is interesting for a couple of reasons. One that, it's sort of the state of the art right now in where technology is moving in healthcare, this idea of patient engagement. And second, it's a project that involves lots of different partners. So this is a project that is examining an intervention in the form of a mobile app for...
Speaking of which.
Yeah. That was perfectly timed. A mobile app for managing diabetes amongst older adults. Okay, so why are we doing this? For a couple of reasons. Chronic disease is probably one of the most expensive items in healthcare today. And amongst chronic diseases, diabetes is the one condition that is most manageable through appropriate actions that you yourselves take, right? So if you manage your diet, your exercise, and your nutrition, then you can control the condition quite well. So we said, all right, let's explore the optimal design for a mobile app that would help older adults, those above 65, manage their diabetes better. So we partnered with the University of Maryland School of Medicine, the Department of Endocrinology, our computer science department, and the Fraunhofer Center for Software Engineering on campus, our psychology department to understand the human motivation underlying why you may or may not use a particular technology, and then of course us in the business school who know a little bit about making these innovations work. We designed and tested an app, and we are currently doing a pilot trial in the Baltimore Veterans Administration Hospital with a population of older adults. So what do we want to be able to say at the end of the day? At the end of the day, we want to be able to provide real evidence-based insights into whether such a mobile app works or not, to what extent does it affect those outcomes that you spoke about, right? To what extent does it help older adults manage their diabetes? And what, if any, changes would we need to make to systems like this going forward as more and more people become digital natives and people like yourselves have to start, managing your diabetes or whatever other condition might be? What else can we tell the future generations of patients as to the value of these apps? So that's one example of a recent project.
Great.
Yeah.
Yes, Mohammed.
Hi, I'm Mohammed.
Hi,
I'm a
Mohammed.
first year. Thanks a lot for coming.
Sure.
My question is more about wearable technology
Yeah.
and how do you see the future of this affecting the healthcare?
Mhm.
Especially now we don't really go around running unless we have our Fitbit, and
Yeah.
we don't actually even walk sometimes unless we make sure this is monitored.
Yeah.
So I want to make sure, how this impacts the future of healthcare, but also how they can utilize this technology to aggregate our behavior in general.
Yeah, that's another great question, and I'm glad you brought it up because the wearable space is another area that we have a couple of research projects in. You may have heard of something called the Quantified Self movement, right? This is sort of a big movement that's slowly sort of spreading amongst the ranks of the young, and what Mohammed described as an example of the Quantified Self movement, right? Where we're all wearing Fitbits and other kinds of wearable devices. The Apple iWatch that was released is part of the Quantified Self movement. And I think there's a big play here for wearable technologies. In fact, even Under Armour and Nike are getting into it, right? Because they have their shirts and their shoes, etc., can capture all kinds of really granular data about you. Okay, so what's the goal here? The goal here is to say, can we understand the behaviors, the activities, the specific things that every individual does on a day-to-day basis, capture that data and marry it with your genomic profile, with other kinds of clinical or health data that we might have about you, to get a really personalized understanding of who you are and what types of therapies might work best for you. So it rolls back into the earlier point that I made about precision medicine and personalized medicine. And certainly wearables are a big trend. Medical providers, doctors, as well as insurance companies are looking into them as a potential way of greater patient engagement as well, right? So, if you can't measure it, you can't manage it, and that's the point behind wearable technology as well.
My name is Shane Salton. What I've noticed in some of the trends in healthcare, and specifically revolving around technology, is that there's a really big resistance to technology as it relates to privacy and privacy of the data. Do you see that as kind of one of the biggest resistances as well, and how do you see getting past that?
Yes, privacy is certainly a big concern, and it is front and center in the minds of a lot of people when it comes to their willingness to share their personal health information. There are always trade-offs, right? So we always refer to what we call the privacy calculus, which is I'm willing to disclose as much information about myself as the value that I get in return for it. So to the extent that disclosing some personal health information would allow me to get medical care that is more suited to me, I might be willing to do it. Now, it is true that in the United States, the privacy infrastructure and the legislative framework has lagged behind pitifully, right? And Congress is just waking up to the fact that, if we truly want to see this technology-enabled healthcare transformation, we've got to put in place appropriate checks and balances. So yes, the privacy debate is quite strident right now. But I think a lot of policy organizations and the Congress and government and various think tanks are working very hard at resolving some of those issues, right? So as an individual, as a patient, I would feel comfortable if I knew that there were the right regulatory norms and principles in place and that I had recourse if something happened. But, there's no denying the fact that privacy is a concern. Yeah.
Good afternoon. I'm Karnataka, I'm a second year. My question is related to do-it-yourself or self-care technologies. Could you talk about the future of self-care and how it's going to impact the healthcare costs?
I mean, there's a continuum of self-care technologies, right? I would characterize our current state of the art as being at a very rudimentary stage, right? So right now, the self-care technologies are really in the form of apps that will help you monitor and perhaps give you personalized advice. Down the road, it is not inconceivable that patients could get engaged in taking even more care of themselves and performing certain elementary procedures, right? So for example, it's been suggested that, even right now, people take injections themselves, but soon the technology will evolve to be sophisticated enough that you can pretty much administer any kind of injection yourself without having to go see a doctor. You might, and this is a technology that's under development, you might be able to complete a full blood work at home with the right devices, right? So you wouldn't have to go to the lab to get the blood test done, and the data would be available right away and as frequently as you wanted to at an affordable cost. So your question about where do I see the future of DIY technologies in healthcare, I think we're going to be limited, at least in the next couple of decades, to these kinds of applications that I just described. I don't envision a future yet where, and I don't know if I want to envision a future where, we're performing very complex medical procedures ourselves. But certainly these, simple ones related to testing and, basic kind of medication management, we should be able to do a lot better. And I know of many companies who are actively developing technologies in this space, including large firms like GE and Siemens. Yeah.
I'm Chris Shea in communications. I'm kind of struck, and I wonder if other people have the same experience, by the gap between what we can do and then what we actually see when we go to the doctor's office. So, my family we've had the usual mix of ordinary visits and specialist visits. And every time, it's been my experience, you fill out a piece of paper with all of your operations and the medications you take. Why isn't there yet a centralized system where the doctor can look that up? Or does that exist and they're not making use of it? And then I've also never been in an experience where I have cost shopped either a test or a medication. And when are we going to start being prodded to do that?
Okay, so there's many parts to your question. Let me address the let me address the first one, right, which is about the annoyance at having to fill out the same information over and over again when you go to see the doctor. Okay, so in theory, we have these organizations called health information exchanges, which are supposed to be repositories of all clinical and medical data related to patients, right? So Maryland has one, which is called CRISP, which stands for the Chesapeake Region Information System for Our Patients. These organizations were conceptualized 6 years ago. Okay, they still have to get off the ground because they're stuck in a regulatory mire. They're also stuck in the privacy concerns that patients have about sharing their information. So at the current time, they're only providing very small bits of information to hospitals, but nothing to private practices. So it is there in our future, Chris. When it's exactly going to happen, I can't promise. But yeah, the information is being captured. Point number 2, cost shopping. So Medicare, the CMS, just released a whole bunch of data about the comparative costs of different healthcare services. That data are still in what I call, for IT experts, you'll probably understand, what I call flat files. In other words, it's not very easily accessible and manipulable by common people like you and I. But fairly soon, okay, and by the way, the state of Massachusetts has recently pioneered a system. Fairly soon, you'll be able to go on the web and say, I want a hip replacement. And you'll be able to find the comparative costs of that hip replacement in all of your neighboring hospitals, right? So you put in your zip code and you'll get a complete map. And I also have some students who are working on an app for that, taking the Medicare data. So it's not too far away. Does that answer your question?
Yeah.
Okay.
How many of you are considering careers in healthcare? 3 or 4 of you. Okay.
So if you have an opportunity, come talk to us. We have a lot of internships and other kinds of projects for MBA students to work on. And we've had a number of MBA students work with the center in the past on experiential projects and other kinds of projects, and they've all gone on to get terrific jobs. So I'd be happy to sit down and chat with you, or Ken Crowley, the deputy director, would be happy to chat with you. I mean, health data analytics is a rapidly growing field. And, I get a call almost every other week from some company that's looking to hire. So if you have skills in data analytics, this is a good opportunity to kind of flesh them out in the context of healthcare.
A lot of you who did not raise your hands, I bet will be working in healthcare. It's the reality, as you said, 18% of the economy. It
Right.
touches a lot of us.
Yep, that's
one
where
way
the
or
jobs
other.
are.
Exactly. Also, just in terms of events or other things that SHIDS has that students may be interested in.
Yeah. So we do a number of thought leadership workshops and activities throughout the year. Just last month, actually September 11th, we hosted a workshop co-sponsored by the FDA on looking at social and mobile data and to seeing how useful it is for informing product safety decisions, because that's what the FDA does. Coming up next week, we have the workshop on health, IT, and economics. It's a 2-day workshop that's held in downtown DC, and we have a number of academics, practitioners, and some really senior policymakers come and speak about the future of what's going on in healthcare and technology. We have some seats available for students. If any of you are interested in attending the workshop for half a day, full day, whatever, do let us know. We'd love to see you there. We occasionally have speaker series, and we'll send out the invite to all of you, so to come and attend.
Right. Any other questions?
Well, I look forward to lots more interaction with you and lots of interesting talks about healthcare. I'm happy to talk about this anytime. So if you feel like you still have some questions, stop by the office. I'm right around the corner from the dean, so you can't miss me. Okay?
Great. Thank you so much, Ritu, for doing this.
Thank you.